central intake at PSS. The focus of it was to help drive families into the 3 evidence-based home visiting programs that every county has and that we have at PSS, and put them in one central place where a central intake program could access them and then outreach them and try to connect them with home visiting services. But in 2015, the Department of Health said, okay, let's get the rest of these counties into the system, but we're going to do it a little different than DCF. Yes, we want you to still focus on those home visiting eligible families, but we're going to open it up. We're going to make it universal and available to everyone. And we're going to have a helpline where anyone from the community can call in with any kind of need, and they'll be connected with an intake specialist whose primary function is to know about all of the local resources in the community and then work to connect the family with those resources, and then follow up with the family to make sure that they successfully connect. So when this grant came out, it was the perfect program for PSS because we had already been doing all of this work. We have been central intake in Sussex County for, at that point, it had been almost 30 years. So this grant was a perfect fit for PSS. And when we got it, it was a natural fit to take the central intake program and build it into our already existing intake processes that we had in place at PSS. So the central intake program became our intake department at PSS. So yes, we had been doing all of this work all along, but the beauty about having this grant at PSS was that it started to make all of that work more visible numerically. It started to quantify all of the work that we were doing. There is a tremendous amount of data entry that happens in this program, and it's all done by the intake specialists and additional data support staff and volunteers. But every time we reach out to a family, every time we call them, leave a message, talk to them, all of that gets documented. What we talk to them about gets documented, all of the referrals provided and the resources and the programs we connected to them, and we have to document all of the outcomes from these conversations. So from all of this work that's happening on an ongoing basis, we can now see the tremendous numbers that we've talked about, right? So we know since the program has started, we've had over 12,000 families call into Project Self-Sufficiency for assistance. We know that we've done over 60,000 follow-up calls with these families and provided over 45,000 referrals to resources for them. So since the beginning of this grant program, the Department of Health has started to layer in different initiatives. So in 2018, they said, yes, continue to focus on your home visiting population, but we want you to start thinking about women of, all women of childbearing age between the ages of 15 to 44, women who are pregnant, have children, have never had children. We want you to focus on them and then provide health-focused case management to them. And then a little after that, they rolled out the Early Childhood Specialist Initiative, where they said, okay, now focus on households that have children under the age of 5 in them. And for these households, we want you to talk to them about child development milestones and the importance of child development screening. And we're going to set up this portal and you're going to show them how to use it. So they want us to talk about WIC and breastfeeding, safe sleep, and then most recently, COVID. They want to make sure that we're talking to all of our families about COVID safety, safe hand washing, wearing masks, getting tested. First and foremost, it's all about giving the client our 100% attention and forming that relationship with them, right? Listening to what they're going through and what their needs are. So we're doing a lot of screening in these initial phone calls with clients. We're screening them for mental health, suicidal ideation, substance use, tobacco use, medical history, lead prevention, prenatal care, employment needs, education needs, housing, transportation. But this phone call is what's helping address isolation throughout the area. It's their way of maintaining a sense of community, right? A sense of connection to other people. You can tell by the lines outside of our food pantry that families right now do not have what they need to meet their basic needs. They are in full survival mode right now, figuring out how to get from one day to the next. And it's not just the lowest of the low income. It's the moderate income households that are being impacted as well, and the higher end of that too. The flip side of that, we are hearing a tremendous outpouring of gratitude for what PSS is doing right now and what PSS means to them right now. And this is especially in regards to the toy shop and our food pantry. It's so important, I think, to realize what PSS means to the community right now. It's doing so much to lift people's spirits and to give them a sense of hope.